What type of gum disease are out there? Dr. Zymantas, we hear that there is, gingivitis, periodontal disease, gum disease. Is it all one and the same? Do they mean different things? Tell us.
Yeah, there's primarily two types of gum disease. One is called gingivitis, and gingivitis is the beginning of most gum diseases. And gingivitis, when you have gingivitis, what that means is that you have an infection in the soft tissues. The gums are inflamed, they're infected, they're bloody, they're pussy, but it's pretty much limited to the soft tissues around the teeth. Some people periodontal disease is also a genetic problem. There are some people that will never develop what's called periodontal disease. Periodontal disease is a disease where the bone begins to be affected and your gums start peeling away from the tooth, and as it starts peeling away from the tooth, the bone underneath starts being resorbed away. It starts pretty much like melting away, and over time, if it's not properly taken care of, people either will lose their teeth or will need advanced surgical treatment to correct the problem.
Okay. Now, most dentists keep talking about when you have periodontal disease that the biggest problem happens to be tooth loss. And we talked about tooth loss, the bones shrink, and you get a caved-in face if you don't replace it with implant, which in itself is an expensive situation, and even putting denture on it has a lots of problems. So anyway, losing a tooth is not a good thing, but losing a tooth today is not exactly anymore as devastating as it was when George Washington apparently had a wooden tooth. I mean, that must have been a difficult thing to have in your mouth. If he did, I don't know. But apparently, from what you're saying and from what other dentists are telling me, here's this thing. While you have a gum disease, yes, your teeth fall out because of the bone shrinking and all kinds of stuff, and that's bad. But a disease is a disease. An infection is an infection, and if you have that yellow, reddish, ugly pus, and if you have that in your mouth, which is the gateway of the blood vessels, and it goes into the blood vessels very fast, like if you put salt or something under your tongue, it goes into your blood fast. So here you have an infection which travels to the brain, travels to the heart, travels to the kidney, to the liver. I have heard doctors saying in Japan universities that the immune system gets so low that HIV can turn into AIDS much easier. Even babies in California have been stillborn and all kinds of things. So it looks to me that the infection in the mouth is much more devastating than the tooth loss, which with a little bit of money can be fixed at least. But how do you fix your liver, your kidney, and how do you justify a stillborn baby or any some such thing, or the next flu season if your immune system is down? Am I way off here, or what's the deal?
No, you are absolutely correct. There's more and more research being found. It seems like almost weekly, linking periodontal disease with other types of problems. The factors that are developed called C-reactive proteins that go pretty much. It goes the infection from your gums travels to your liver. And in your liver, you develop these C-reactive proteins that go throughout your heart, throughout your whole body. And say in your arteries, the C-reactive proteins start building up atherosclerotic plaque. And everybody knows that buildup of plaque will lead to either strokes or heart attacks. So that's just like one simplistic one. There are also different kinds of plaque that develop in your brain. They have found pancreatic cancers that are mediated by periodontal disease, and it's kind of funny. The inner lining of your gums, if you added up that entire amount of area inside of the gums that are infected, it's about the size of the palm of your hand. And if one day you would wake up and your palm of your hand was bloody and weeping and a bloody sore, you would certainly want to go do something about it. But somehow from old wives' tales, more or less, or something, a lot of people are okay with having some bleeding gums. When there's nothing further from the truth, then they really need to address it as soon as possible to reduce the problems in their future.
Well, yeah, I mean, that's a good example. I mean, you wouldn't run around with a bleeding finger, never mind a whole palm, being, or like, a toe or something like that. It's all very alarming to people and to us, correctly, should be, but we apparently in here we go, so what? It is alarming. I mean, is it true that some pregnant women, never mind that there's only 1 or 2 cases with a stillborn baby, that's an extreme, but that there is a lot of underweight babies born because of it?
Yes, that is very common. That's one of the biggest prenatal care. Before a woman gets pregnant, she should, or if she's planning her pregnancy, she should certainly make sure she visits her dentist and gets an evaluation of her gums to make sure that she doesn't have any periodontal disease. Because I personally, from a kind of like an empirical way, meaning I just kind of like from a feeling, I have some patients personally who have had periodontal disease issues, and they have had low birth term weight babies. There's no direct link, but from a statistical standpoint, statistics and research does show that periodontal disease will lead to low birth term weight babies. So that is definitely something women need to address, ideally before they become pregnant.
Well, and of course, then there's the overall thing. I mean, a lower immune system. I mean, who wants to have a low immune system when the next flu season comes around? I don't.
Correct. You certainly want to. It does, and it really doesn't matter. When you develop these C-reactive proteins we've been talking about, it doesn't matter if your infection is in your finger, your toe, or your arm. The infection, your body doesn't know any difference. It's gonna treat it, and it's gonna have these C-reactive proteins from this infection. The problem is when you have an infection in the gums, oftentimes it's sort of disguised and it's masked. Most of the time, periodontal disease is painless. Oftentimes they say on dental brochures about periodontal disease, don't wait till it hurts, because if you're hurting if you wait until you feel pain or discomfort in your mouth, it's probably very late in the game, and you've got extensive problems bodily as well as in the bone surrounding your teeth.
Basically, by the time your teeth are starting to fall out and play piano because they become all crooked, by the time you, for a few years, poisoned your body and weakened it because all the soldiers which fight the immune system and make your body good had to go here, and they have no more room to go and fight any other fight. You have a poisoned body by that time.
Correct. It is a slow, gradual deterioration, pretty much of almost every system in your body.
Absolutely interesting. Not interesting, absolutely alarming. I think I better should end this video shooting here and go and see my dentist. It's only Sunday night, 8 o'clock. I'm sure he will see me right away, right?
Correct. No matter what time.
Okay.
Always there for dental care.
All right. Bye-bye, Dr. Zymantas.
Goodbye.